A spring 2015 mouthhealthy.org poll asked readers if they brush before or after they floss. 53% say that they brush before, while the other 47% say that they brush after. It doesn't really matter when you floss as long as you do it. Flossing is an important part that contributes to having healthy teeth and gums. I recently applied to dental hygiene school and in the next few years hope to become a licensed dental hygienist. There's really no right or wrong way to floss, but I truly believe that there is a best way, and that is what I'm going to teach you today. The American Dental Association recommends that you should floss at least once a day to remove the plaque that's on your teeth. If the plaque is not removed, it can become calculus or tartar, and that can result in having cavities. Johnson & Johnson says that 87% of people either floss infrequently or not at all. So what you're going to do to floss is you're going to grab some dental floss and you're going to get about 18 to 24 inches of the floss. You're going to wrap it on your two middle fingers like this, and having one spun more than the other. So it's tight that you can pull with your thumbs. So then what you're going to do is you're going to go and you're going to, on your patient, you're going to put it in and you're going to do it in a C formation of back and forth motion, making sure the dental floss goes all the way to the gum lines on both teeth. To get it out, you're going to do it back and forth. So to get a new clean piece of the floss, you're going to wrap it around the tooth around the finger that has less floss on it. So now you have a new clean piece of floss to go onto the rest of your teeth. And you make sure you floss every tooth. And you want to make sure that you never floss so much that your gums are heavily bleeding or that can cause damage to the tissue. There are alternatives to flossing for people that either prefer them or they're required to because of obligations that they have in their mouth, such as braces or bridges. For patients that have braces, there's something called a floss threader. And what you do with this floss threader is you'll use the regular floss and you will thread the floss through the floss threader, and then this piece of material will go under the wire and you will floss just like regular. There's also this piece of floss that has a hard string connected on the end, and then the rest of it is just regular floss. And these go through the wires and through the brackets, so it's easier to guide through. This also works if you have a bridge under your tooth, so then it can go under the bridge and you can floss under it. Another alternative to flossing is a floss pick. The floss pick is kind of like a toothpick on one side and a flosser on the other side. This is used for easy, convenient, quick ways whenever you just have something stuck in your tooth. There's also something called a water pick. This water pick is a little bit more expensive, but it's like a pressure washing mechanism. And what it does is it shoots water out and it will flush out all of the plaque and debris that are on your teeth, and it'll help in the aid of flossing if you just need something quick and easy. Dr. Katie Beach of the Shreveport-Bossier Family Dental Care states that there are two major kinds of bacteria in the mouth: the type that causes gum disease and the type that causes cavities. In summary, flossing is an essential part of having healthy teeth and healthy gums. Like I said, it doesn't matter when it's done as long as you do it. Flossing is very preventative in the helping of cavities, of not having your cavities. Dr. Beach says when patients ask her how important flossing is, she always tells them you only have to floss the teeth that you want to keep. So like she says, always floss.